Are you a business owner looking to secure your financial future and create a lasting legacy? I'm Leah Garcia, a financial strategist and insurance professional, and I specialize in guiding businesses with up to 50 employees on how to effectively protect and transfer their wealth. We break down silos with my unique approach, the Wall of Wealth. Imagine a seamless collaboration among your CPA, tax attorney, estate planner, and insurance expert, each playing their part in perfect harmony, ensuring your financial strategy is not just effective, but a true masterpiece. My passion stems from my own journey, from growing up on food stamps to dreaming of building community centers that empower others. Together, we'll craft a roadmap that not only safeguards your assets, but also nurtures generational wealth for your loved ones. Let's transform your vision into reality. After all, you can't measure the heart of a champion just by looking at them. Join me, and let's make your financial future shine.
And we are live. Welcome to this episode of Wealthy Wednesday. I am so excited. My hairs on my arm are just on edge. I'm just so overjoyed with my guests and this conversation. You know, we're going to talk about our health and our wealth and how they all critically go together. Today is going to be one of those. I want a lot of engagement. I want to hear from you. I want your questions. And you know what? If you're an entrepreneur, solopreneur, business owner, come on in. I want you to shout out and share what you do. Someone is looking for you and what you do. I want you to share your whatever you have, your card, your event in the comments. I want you to network with each other. It's all about us collaborating and masterminding. I believe that a rising tide raises all boats, but only if your boat is in the water. And what I mean by that is you need to get involved. You need to have a conversation. You need to rah yourself. Okay. Today, I have to say, you know, we have an author, a published author, by the way, CEO, founder. She's also a board certified patient advocate, but she is so much more than that. I have to tell the story of how I met her. I was actually introduced to her by another colleague. You never know how an introduction could impact somebody in their business. And we connected, and I loved her story. I loved her crusade. And she said, you know, I'm just getting started on the social media journey. I could use a little help. And so, you know, listen, I'm not a social media guru. I knew a few things and I gave her some guidance. And you know what? She took that and ran off with it, exploded. I mean, and, you know, so many times we share wisdom or golden nuggets with people and they don't do anything with it. This woman took all the juice out of the orange, and I'm just in awe of what she's done. So without further ado, please give it up for my incredible friend, mentor, leader, and just cute as a button, Miss Sandra Washington. Miss Sandra L. Washington. Take it away, Miss Sandra.
I want to say thank you very, very much. And you're so right. When I met, I was going through so much. I was going through illness myself. My mom was seriously sick. And I was like, okay, well, I am good on Clubhouse because I had been on Clubhouse speaking about healthcare for like 2-3 years. But this seems to be a whole nother level up. And how can I do it without stepping back and without, you know, being a pain to myself and getting in my own way? And because that's so much what we do. And so you talking to me and you're like, Sandra, you got this. You gave me some pointers. And I was like, that's really all I needed. And that's all anyone needs is someone. And I tell people this all the time, watch your circle. If you're trying to do something that your heart is set on doing, watch your circle. So that's what I do want to say. What I actually also want to say is I stepped away from being a board certified patient advocate. I want to say maybe 2-3 years ago. I still have friends that are BCPAs, but I actually had to step back because I was because we were out of alignment with each other. So I still wish the BCPAs I'm still friends with, I still wish them well. in their endeavors and what they wanted to do. But it wasn't something that I wanted to do, and it wasn't something that was going to serve the people that I look at and I try to help. So I actually had to step away from that.
Absolutely. And we have a few people who joined us. I want to welcome you in. And by the way, invite in another entrepreneur. Invite somebody who you know needs to hear this. I want to welcome my good friend, Miss Kendra Knoll. I'm going to actually be a guest on her up and coming podcast. I believe she's scheduled to kick that off here in just a few weeks. And I'm so excited. I'm so proud of her too. I've just watched her expand and explode. She owns Boomtag Media. If you want to upgrade your social media game, I highly recommend you get together with my good friend, Miss Noelle. And Peter Muffler, it's so great to see you. Thank you for joining us. You know, he's multi-talented. We call him Popeye because he's in such good shape, but also he's a great, amazing singer. Sing your heart out on Fridays with Miss Noni Veroni. And she says, flip the script and do a cartwheel. I'm not sure what time Sing Your Heart Out is on this Friday. I think they're doing it at 6 p.m. Kind of still my work hours for me. But if you can, if you're looking to just kind of have some fun on Fridays, a fun way to end your week. And then, of course, my good friend is Christine Bailey. She has been a guest speaker on this show, and now she has her own podcast. She's been another one of those little baby birds, and not mine, but, you know, I met her when she was just getting started, and now this woman has authored almost 3 books, and I'm talking about, it's only been a few months since I've known her. She is an incredible woman. She says, no God, no peace. No God, no peace. You got to check out her podcast. It's incredible. Please share your events in the comments. People are looking for you. So, Miss Sandra, I would love to just start. Let's kind of start with where does this crusade come from? You know, you're such an advocate, even though you're not pursuing that, you are by nature. It's in your DNA, a patient advocate. Where does that come from?
You know, it comes from the fact that I am it. So the very people that I work with helping look like me, live amongst, we live in the same community, and we've seen the same hurt going across the board. And so that's where my drive comes from, to do well, and not just so much to do well, but to be at the top of the game, to ensure that all patients receive optimal health care, and to work within those silos that touch upon patients' health, such as financial advocacy, financial planning, to make sure that when patients are looking for help, they're receiving the help that they need. And so that's where I get my drive from.
Yeah, and it's so needed. I think I've shared this a little bit, but I will tell you that I currently, this past year, I think I've got 4 clients who are dealing with a cancer diagnosis. And it's so true. If, you know, I talk about it, I'm going to shout myself out. I talk about the Wall of Wealth. It is my 1-page financial plan. I put this together. It is proprietary. In fact, I'm going to end up taking it to the next level, but it's something I've been sharing with my clients for many, many years. And it has evolved over time. And the reason was because I would find people who, well-meaning people, who bought stocks. They invested in real estate. They had all these other assets that I put as a cherry on the top, but they didn't have the proper health insurance. They didn't have any life insurance. They didn't have any living benefits. And as soon as something happened to them medically, they got hurt. They had a diagnosis. You know what they did with that real estate? They start selling it off on a fire sale because they need this money to protect their good health. So it has been, so when I realized that, that's when I started to say, we have to have order of operations here. And so the first layer of the Wall of Wealth is your health insurance, making sure that you have the proper and understand your health insurance. That is where I start. Even when they say, Leah, I have $1 million. I want you to invest it for me. I said, that's great. We need to start here with the foundation. What kind of health insurance do you have? Do you understand it? What is your deductibles? What is your I'm not worried about the copays. I want to know, what is your out of pocket? Is it an HMO? Can you go and use it anywhere that you want to use it? In state, out of the country. Those are the conversations that I have, because I understand if we don't put in that foundation, that is the first brick. If we don't lay that brick properly, nothing else that we put together is going to last long term. They will come back and they're going to need to pull out money out of their investments because they didn't have the proper health insurance. So how do you help people as a patient, just being there for them and wanting everyone to have the proper insurance and the proper health care? What do you do for them personally? How do you do that?
I actually work with in the silos of those companies and businesses that work with patients. So when it comes down to financial planning, and I find out that you're a new entrepreneur, you're a new business owner, my question to the patient is, okay, well, that's great. I'm glad that you have that, but what is your health insurance? What does it look like you said? Because a lot of times when they'll go and they sit down with a financial planner, they're not being asked about their health insurance. That's the last thing they're thinking about. But yet we hear day by day and day after day about people who have had these, these companies, and they're in medical debt. How you get in medical debt? Like, where was your thinking at when you started this business? And why are you not starting with people who are asking you about your business? I tell everyone, when you sit with a financial planner or you sit with a real estate agent because you're buying a house, you need to make sure that you've got a special pot that actually says health care. Because if you don't, like you said, Leah, it comes down to the point where you might have $1 million. But if you go into the hospital and you have an HMO and that HMO didn't cover that hospital stay, you ain't got $1 million. You really don't have $1 million. And so many times what it takes is just education, education, education. I believe in educating patients because if they're educated, they become empowered, and then they become engaged in their healthcare journey. And their healthcare journey isn't just about their healthcare. It's about everything else that impacts their healthcare. So that's how I work with the patient, and I also work with those companies that are trying to do business with the patient so that they can understand exactly what they need to do in order to not only start a business, but make that business sustainable. What's the sense of starting a business if the year after you started, you got to close it down because you got hit with a healthcare bill and you got to pay it, right?
Yeah. And you know what? We're entrepreneurs. We're tough. We're resilient.
Right.
Listen, we break something, we put a Band-Aid on it. We're going to do whatever it takes. But there are times when you have no choice. Your body won't allow you. You're in critical care. You're in a coma. You're dealing with your diagnosis. And it's just don't have that physical ability. Man, this brings to mind so many stories. And just what you alluded to, Miss Sandra, is that, I have somebody who recently, she's terminally ill, and she literally started liquidating her wealth to save her health. And the health insurance I had told her about a year prior. I said, you know what? I understand you've got all this investments. I understand you travel the world. I understand that you've got all this real estate, but let me just help you to understand. The health insurance you have is an HMO, Health Maintenance Organization. It is wonderful for maintenance. Think about it this way. We go to Jiffy Lube to change our oil on our car. That's great. But if my engine breaks down, I'm not going to Jiffy Lube. Right now, you have a Jiffy Lube health insurance. And she said, you know what, Leah, I'm not worried about that. I'm in great health. Look at me. I'm 65. I look great. I feel great. I travel the world. I'm not worried about it. And we're all healthy, Sandra, until the day we're not. And
that is so true.
With a, third, what do they call it? Stage 3 cancer.
Right. Well, stage 3, stage 4, stage 5. And it's not just cancer. It's so many other health conditions that people get. And I tell, right now I've started, I don't want to say I've started, but I've actually pushed up my level of telling people who ask me, well, what do you do? And I tell them what I do. And they're like, oh, I don't need that. I'm not a patient. I'll go to the doctor just yet. You don't have to go to the doctor just yet, but you are a patient. And I've classified it as this. You're a patient. You're either a proactive patient, a active patient, or a retroactive patient. The proactive patient knows that in the future, my life is possibly going to change, and I'm going to need to make sure that I have all the health insurance that I need and everything else that I need to make it. And they start planning. They meet with a financial strategist such as Leah, who knows that, okay, well, we could talk about all this other stuff, your investments and stuff, but let's get you the foundational basics. So before we can start planning, because without that, we can't do that. Leah is one of the ones that are good because of the fact that she knows that. And so she knows, I'm going to tell my clients because I care about my clients. I care about the investments, and I sure do. I'm not going to lie. That I care because I'm a financial strategist. That's where my income comes from. But I more so care about the client that I'm serving, and I want to make sure that they know that I care about them. So I'm going to do the extra, and I'm going to ask them these questions to make them think. So you have a proactive patient that takes care of their business well before they have to take care of it. So when a medical emergency comes up, they're like, I got that covered. You got to stop being a business owner and being cheap and go with an HMO. You got to spend that money. And when you spend it, you got to put yourself first. So that's a proactive patient. Then you have the active patient who just finds out that you have a diagnosis. The prognosis isn't good. You still got time, because now you need to find someone, especially a financial planner, that can help you, that understands that you need to have a health insurance plan that will actually take you where you need to go. Then you have a retroactive patient. That's the patient that you was just telling us about, the lady with the cancer who you told a year ago, you're going to need something else other than the HMO, especially if you're traveling, especially if your life is active. It's going to sneak up on you because you're not expecting it to happen. So that diagnosis or prognosis, that you ain't expecting for that to happen, but it happens all the time. But you chose to take the low road out and say, well, I'm healthy now. I can just spend the basics. I ain't got to. No. Stop doing that. Really stop doing that. So once again, you need to have someone like Leah who understands, you know what, if I don't know the answer, or I don't think this is right, I'm calling Sandra. Right? I'm getting Sandra, I'm emailing her, texting her and saying, hey, I have somebody I need you to talk to, but I'm getting you some help. And so you align yourself with those people that can help you when you're really not sure, but something just doesn't seem right. When you're looking for a financial planner, that's the type of person you want, not somebody that's just selling you all finances without thinking about what's going to happen. Because if you're not a patient now, at some point in time, you will be.
Woo! That was fire. If you're watching this on Team Replay, we love you, Team Replay. Rewind that. If you're here live, I want you to come back and listen to that again. That was fire. You are so on point. And you know what you've done? You sold me on me. And this is what I mean by that. Sometimes I will have people who come to me and they get a little put off because I do want to know what their health insurance is. I really do. And they say, oh, you know what? I just want the investments. And really for me, I can't go forward because I know I'm like a doctor. First, do no harm. And if they don't have the proper things in place, I know what will happen. So there are people that have elected not to move forward with me. And you know what? I'm okay with that. But now I'm really even more an advocate for that. If you don't care about your health insurance, don't come to me, because I'm going to ask you what it is, because that is really the first cornerstone. It truly, truly is. I've been in this business almost 20 years. And I have seen it over and over and over again. Everybody is healthy and then bam, they're sick. And now suddenly everything changes. That investment they had, they don't even care about it. They're trying to get rid of it as quickly as they can. So, man, that was incredible. You absolutely exude this. And it's pretty amazing to me that you know so much about health insurance because you're not licensed. You know more about health insurance than most people that I know that have a license for health insurance. And I want to highlight something you alluded to. When it comes to an HMO and a PPO, okay, folks, don't get lost in the sauce. Okay, I'm going to make this really, really simple. An HMO means that you have to go to the doctor on the island. Okay, that doctor hospital has to go. You can only see the ones that are on the island. A PPO, which are very, very few these days in the health insurance industry, means you can go to any doctor on the island or on the mainland or anywhere in the world. That is what a true PPO is. So why that's important? Listen, many illnesses, there's one specialist in the country or even in the world. So do you want to have access to that doctor or hospital that is a specialist? But here's why most people choose an HMO. And you share this, Miss Sandra. Listen, you guys know this is me. This is a gloves off, pull the curtain back. There's no secrets here. It's because HMOs are cheap and they're easy for the insurance company to write up. It's easy for the agent to write up an HMO. There's no qualified. It's like really simple, boom. And if they're doing Medicare, I'm going to tell you another secret, guys. If they're doing Medicare, they get paid really good money to write up an HMO. I used to do Medicare years ago. I stopped because I saw the difference and I could not in good conscience sell HMOs. That's all I'm going to say about that. But how did you learn so much about health insurance? Because you could pass a health insurance license test like right now today without studying.
You know, I have been in the health insurance field for 35 years. So I've been in health insurance for 35 years. I went to school I had my master's in public policy and administration with a concentration in healthcare. So I know that's where I know everything from. And once again, I live there. I live in the world of health. I could have chosen, and so many people right now say, Sandra, but you could do just about everything. And I can't in healthcare, and I can't. I could have done something else in another field, and I chose not to do it. I chose to pick my focus, and my focus is in healthcare. So studying healthcare and knowing how to help my community and help the people that I service, I'm glad that I stayed in the field, even though people kept saying, Sandra, this is hard. You ain't going to do. I'm glad I stayed where I was, grounded in what I know, because that made me a specialist. As far as being a licensed health insurance, I'm an entrepreneur for a reason, right? Yeah. I don't want to be reporting to anyone anything. I did it for 35 years. I mean, I'm capable. I stayed in health insurance in the health field and diligently studied, and was obedient to my was obedient to God and making sure that I was well grounded in what it is that I do and how I do it. Me working for someone, I can't. I mean, that's there, and it's good for people that have to do it and that want to do it. But as an entrepreneur, I get to spin it the way that I want to spin it without actually having to report to someone. I did it for 35 years. I'm done. I can't, I got to the point where I'm like, I'm done. I got to do my own stuff. So yes, I could pass a licensed health insurance exam, but all it would do would be allow me to sell health insurance. I'm so much more than that. So much more than that.
Yeah, for sure. I want to welcome a few more people. Miss Nick, she has a great comment here. Miss Nick Galindo, she says, ouch. My diagnosis, let's see, I have my diagnosis to manage too. I've got my diagnosis to manage too. Health insurance is super important to me. Yeah, I totally agree. I concur. And here's somebody, LinkedIn user. I'm not sure who you are. Shout us out so we know who you are. Impactful identity. impactfulidentity.com. I think you're a new friend here. I don't recognize that. Do you know Impactful Identity, Miss
No,
Sandra?
I don't.
Okay. And then here we go here, Miss Christine Bailey. It is absolutely worth it to have good health insurance, and I don't mind spending the extra money. It's an investment.
It's the best investment you can ever make because it's an investment in yourself. People who are building, once again, I can't say it enough, and I know people are probably like, why does she keep repeating it? Because it's important for you to not only know, but for you to understand. If you're a business owner, if you're an entrepreneur, I don't care at what point and stage that you're either one of them, you need to actually, after you review this video, you need to go back and you need to look and see what it is you have. You need to call, if you have a financial planner, you need to call your financial planner and say, hey, we need to meet. I need to put this into my investments. I need to be doing this because I'm afraid I'm going to lose something. And, I hate to bring politics up, but I have to bring it up because according to the political season is where you're going to find yourself at. So I'm not taking the Republican side. I'm not taking the Democratic side on it. But what I am doing is I'm taking the human side. You have to monitor, mirror what's going on in the political season. You may have to go back and change some things right now. You may have to change some things in the future. Health insurance is not something that you buy. You don't look at it ever again because you just know you have it. You need to be paying attention to what's in it. So you need to actually go back yearly and see, okay, this is what I have. Are your doctors still in your plan? What else could you get? What else do you need to get? Maybe your insurance stopped covering something. Well, do you need a supplement? So you can't buy it and then say, okay, well, I got it now. You got to buy it and look at it and see what it's worth.
Oh my goodness. I feel like I don't even need to talk. I just want to keep you going. Just keep on going. So yeah, I say, listen, this is not a Democrat or Republican. This is a human issue. And whoever is president, whoever is not president, we have to understand that it is something that we need to turn towards and we need to understand it. We have to take the time to study it and at least know your exposure. Understand what your exposure is. All insurance has things that they pay for and things that they don't pay for. It used to be back in the day, I could tell a client, here's your hard stop loss. No matter what happens, this is your maximum exposure. That is no longer the case. There's gaps in every type of coverage. So, and you know what? Even to this day, the number one cause of financial devastation is due to medical bills. And the majority of those people, listen, folks, the majority of those people had health insurance. So we're not talking about people who are going underinsured or uninsured. This is really all of us. We have to be vigilant and be aware. So we're going to take a quick break, but boy, we don't go away because we got much more to cover. And I want to welcome a few more people when we come right back.
Are you ready to take control of your financial future? Introducing Leah Garcia's Wall of Wealth, the ultimate one-page financial plan to protect, distribute, and transfer your wealth with confidence. Whether you're a business owner or just starting your financial journey, this step-by-step guide gives you the tools to create a solid foundation for long-term success. Don't wait to transform your money mind shift. Download your free copy today at LIVEAre.io and start building your wall of wealth now.
This is like a perfect segue because when I met you, you were just starting, not that you were just starting your crusade, you were really just starting your crusade here on LinkedIn. You already had the crusade, you had a lot of things in place. But then as I started to share more of what I did with you, you just kind of took the ball and ran and you created a book, you wrote a book, and out of the blue, you asked me, hey, Leah, I need your wall of wealth. I'm like, yeah, here, how do I get it to you? And suddenly I know that you put it in a book. So tell us about that. What is your book?
I will. Before I tell you about that book, though, I do want to say I actually have 5 books published. 2 are international bestsellers. And both of them are, I was actually asked to be an anthology under Listen Linda Marketing PR, and I actually agreed. So the two bestsellers are from that standpoint. And then I have three that I wrote that are strictly, they actually are fundraisers. So I do have a nonprofit. The fundraisers that we do, because we're a healthcare research and a healthcare resource nonprofit, I didn't want to do candy, cookies, donuts, soda. I wasn't into all of that because that's not health related. So what I did instead was I wrote books. So I have 3 additional books that I wrote. And then I wrote Your Voice, Your Tool. And I asked Miss Leah, I said, Leah, can I put this in? Because I have a section in Your Voice, Your Tool that actually gives guidance, and it actually points out things that a lot of patients don't know that they should know on when you get stuck, this is where you can go. So Leah says, Sandra, of course you can. So I actually have the Wall of Wealth in Your Voice, Your Tool.
That's so awesome. It's still like, I just get giddy about that because I never imagined anyone would listen. When I created this Wall of Wealth, I shared it with everyone. It looked a little bit different than it is today. I didn't have all of the elements that I do right now. I think I started with about 4 or 5. And I would share it with everyone, all my colleagues. I showed them that, and none of them thought it was anything. None of them. To this day, I think most of them think it's just like a poo-poo, and that's okay. Because I'm learning that the more I learn, the more that people need to understand. It is order of operations. We are so out of balance. Everybody's talking about flipping real estate and Bitcoin, but they don't have any life insurance. Everybody's talking about doing all these things that sound all sexy online and the TikToks, but they have no living trust. Like, we have lost our mind. And so for me, that's why I got to be more of an advocate like you, Miss Sandra. I'm learning so much from you. I promise.
And that's actually why I put all of the resources that I actually have in Your Voice, Your Tool. All of those resources are senior. I consider them to be senior subject matter experts for me to actually put in my book, because mostly everyone that knows me or knows a little bit about me will tell you that I don't, I appreciate everyone's advice, but you got to show me something to make me vouch for you or make me say, yeah, I'll refer you to this person or do something. Because our community, and when I say our community, it consists of so much, but our community is already hurting. We don't need anybody else to sell us a fake mountain on the mountaintop somewhere. We need people that can give us information that we can rely on. So that is why I actually said to you, ask you, is it okay if I put your information, Wall of Wealth, in the book? Because once again, financial planning is important for all of us. What's really important for all of us is that we go into financial planning with a complete package. That package includes your health care, making sure you have it. So if I don't, I know you are going to get that point. I know you are going to either tell them or say, hey, here's Sandra's number, because you sent people to me before. I say, hey, here's Sandra's number. Call her and see what she says. Right.
Yeah.
And I'll give the best information I can versus me putting Susie in the book and somebody reading a book and calling Susie and Susie telling them wrong information. That not only hurts her, but it hurts me as well.
Yeah. And let me be really clear. It's more than just checking the box.
Right.
Just because you have health insurance doesn't mean it is a right health insurance for you. And it also doesn't mean that you don't need any type of supplemental coverage. If you are self-employed, and you and I talked about this offline,
right.
Employed, every one of my self-employed people, they have their health insurance, which is usually a medical cost sharing plan. If you've never heard about that before, go on my business box, learn about medical cost sharing plans. If you're in relatively good health, it's an incredible option, super affordable. And I also couple that with life insurance with living benefits, meaning that they have life insurance that has access to cash if they should receive a diagnosis or have a major accident. It works together like this. And a quick story, I have a client a few years ago. He's a roofer in Hollister. He actually was about to cancel his life insurance with living benefits because he said, you know what, Leah, my kids are grown. I don't really need it this much coverage. And I said, remember, this one has your living benefits in it, Barry. So if you cancel this, we got to supplement some type of disability insurance. Well, he saw the premiums on disability. He said, you know what, this is pretty affordable. I think I'll stay with this. And he suffered a heart attack about 3 years ago. Because he had a medical cost sharing plan, now he has an older one. He's been on the medical cost sharing for about 12, 13 years now. His out of pocket, Sandra, was $1,500. His bills were over $350,000. He went to Stanford. He stayed in the hospital, physical therapy. His exposure was $1,500. But oh, by the way, he also had the living benefits. He received a check. Now, this is from a term policy. This is not cash value policy. He received a check for over $225,000 cash paid directly to him, so that he's self-employed. He could keep the lights on in his business. He could hire other contractors. He could meet his payroll and pay his workers. And so anybody who is an entrepreneur or self-employed, if you don't have these elements in place, you're just kind of waiting. You're an accident waiting to happen, in my humble opinion, but that just might be my opinion. So did you actually, I'm curious, did you actually just like study health insurance, or how did you learn so much about it?
I studied it, and once again, I was it. So I have some health challenges myself. I'm diabetic. 3-4 years ago, I was diagnosed with chronic kidney disease. So these are diseases that I live with myself. But I didn't just wake up one day and that's what I was diagnosed with. The signs and the symptoms were there for a long time. I was diagnosed with it after a long time, and things kept happening, and gradually the doctors were like, let us take a deeper dive look. So I was diagnosed with it later, but I lived with it. And so because I lived with it, I had to study it. It was happening to me. It was really happening to me. That's one reason why I did. There's other two reasons. One, my oldest sister lost her life. Well, she lost her life. She literally got gaslighted. And I'm not going to go into gaslighting because this is not the show for gaslighting. But she literally was gaslighting. And that gaslighting actually cost her life. And so, yeah, I didn't have a choice. And then I had another sister who was also the same thing. She was gaslit as well. And the same thing, she wound up losing her life. So not only was I studying it because I was a student of it and because I had entered the healthcare field so very long ago, but I had to keep studying it because I had to keep making a difference where it was that I was.
That is so fabulous. A lot of people get diagnosed with illnesses, but they just kind of assume that that's the way all health insurance works. It's just going to be the way it is, what it is. I got what everybody else has. And they never take the time to really understand and become their own advocate.
Right.
So if somebody is currently, they're in good health, they're an entrepreneur, or maybe even they are an employee and they're not sure about their health insurance, where should they start? Because it kind of seems overwhelming. I mean, I don't want them to feel like they have to go to school and get their license. Where are some key points or some key questions they could ask?
Well, let me start by saying first this. Where they shouldn't start is on Dr. Google or Mr. Firefox. That's where they shouldn't start.
Right.
And unfortunately, a lot of times that's exactly where they start, is where they shouldn't start at. And the reason why I say that is because Dr. Google and Mr. Firefox, unless you know what it is that you are doing and who put the information out there, the information that you are reading or trying to go by, that information could be costing you your life. Because it really depends on who it is and what it is that you're looking at. And many people don't realize that. I've had tons and tons and tons of, and we do our own podcasts and we do videos, and I've had tons and tons of people that tell me that this is what they read off the internet. Well, who put it there? They don't know. They just got it off of Google. Well, they tell us everything else. That's the wrong answer. So what you need to do is there are advocates. Greater National Advocates is a directory that actually has, is gna.org, is actually a directory that has a list of a ton of patient advocates who are not only knowledgeable, but they have experience in what you might not, you may need some answers for. So that's one place that you can start is with Greater National Advocates, which is once again, gna.org. You can reach out to me and say, hey, Sandra, I heard this. Is this true? Or where can I get more additional information from? And I can give you a disclaimer. I'm going to give you my thoughts, but you as the individual that is coming to me, it's your life. I'm not a doctor. I'm not a nurse. I'm not clinically trained. So guess what? You have a right and a responsibility to do is to look into it and see what's going on. And third and most importantly, and not in this order, but third and most importantly, communicate with your doctor. This your voice, this your throat, right? If your voice comes from your throat, it's the most powerful tool that you can use. But yet, day after day after day, we sit silently and we don't open our mouths. The doctor tells us something and, oh my God, we dying. No, not really. Like take do what you need to do to protect your health. But most importantly, use your voice.
Yeah, that is so good. That's a gold bar. I love what you said. It's like, listen, this information could be costing you your life. We're talking about your life. We have to take responsibility for our own good health. And I want to welcome a couple more people. I don't know if I welcomed you, Meryl. Thank you for joining us. It's always great to see you. Thank you, my friend. I appreciate you so much. He always has incredible comments and he's always networking with everybody. I love that. Meryl's like somebody that everyone knows, and we all need a good friend like Meryl in our life. And then, of course, we have our Queen Dr. Leslie Flowers. She says, right here on LinkedIn, at one point, several people wanted to do a room on how to handle fraud amongst our community. Yeah, I hear you. There's a lot of fraud, I'm just going to say it's untruths, right? We have to do our own due diligence. We have to do our own research. And, something a lot of people may not be aware of is many health insurance providers now have something they offer it as an option with some companies. A lot of the clients I have, it's already embedded into the plan, which is called telemedicine, teledoc, something like that, where you can speak to a doctor, a board certified medical doctor via online on Zoom, and it should be at no additional cost. And I love that because you can ask them about anything. If you want a second opinion, you want to know, do you need to go and see the doctor? Oftentimes they can even write and prescribe prescriptions if you're low on your prescription. So that's something I think is kind of a blind spot. And I don't know that it's available in every country, but I do know in the US, there are a lot of programs. So if you are renewing your health insurance, that would be a great question to ask. Also, I would add that. What if somebody's having a current situation? They did get that diagnosis and now they are feeling afraid. And this all seems so overwhelming to them. What would be some words of wisdom you could share with them?
Well, we're in a stage right now that if you've been recently diagnosed with a condition and you're like, I don't have health insurance, nobody's going to protect me, where am I going to get my insurance from? One of the places that I will tell you to check is your respective marketplace to see what kind of insurance you can get. Now, I'm not sure how long that marketplace is going to last. So this is why I say you need to be on the side of proactivity when it comes to your health. Think of these things before it either gets taken away or you become too sick to think for yourself on how to actually avoid these problems that you'll have. So I would definitely check with the marketplace to see what insurance is out there. Contact an insurance broker, in your respective state, because every state is different. So the laws that might pertain to me in Illinois may not be in California, vice versa. So you have to actually make sure that you know what it is you're looking at, and reach out to people that you know, or that you know may have an idea of someone that you could talk to. But most importantly, stay away from Dr. Google and Mr. Firefox unless you have been trained on what to do. Stay away, back up, stay away unless you have been trained on what to look for when you're going to either one or any other platforms. Please stay away from it. It's going to cause you more harm than good.
Absolutely. Another mic drop there. I want to highlight this comment by our Queen Dr. Leslie Flowers, who, by the way, is a scheduled upcoming guest speaker. We had a little bit of I don't know what happened, but anyway, we're going to redo that event because it was incredible. And so she's going to be our guest speaker next week. She also hosts Mind Over Matter Mondays at 7 a.m. Pacific. And of course, our Think and Grow Rich study, which is an ongoing study. That book is a book for me, is something we can study lifelong and always grab new golden nuggets. So I love this comment here, and I'd love you to say more about this, Queen Dr. Leslie, if you're still here with us. She said, we have a real fear of ill health. And why not? Think of COVID. So she talks about the fears. I think she says there's 6 fears. I'm not sure. Tell us how many fears there are. There's 7 fears, 6 or 7 fears that we have embedded in us. The fear of falling, right? Things like that. And one of them is the fear of not having good health. So it's embedded in us.
It is. But here's how you overcome that fear. You become proactive. Because when you're proactive, that means all of everything that could possibly go wrong, and this not for healthcare, but this is for any other fear that you may have. Become proactive about overcoming it. How do you become proactive about overcoming your ill health challenges? Take care of your business now. Because if you take care of your business now, you're not going to care about what happens when you get sick, if you get sick. Your fear is going to go away because you already have everything planned on how to successfully maneuver around it. You have a fear of ill health because you're not paying attention to you're not paying attention to your health. 2, you have no idea when that health issue happens, how you're going to overcome it. You're not going to overcome it by being retroactive and sitting waiting for it to happen and just living your life in fear. Take responsibility for you, become proactive in your health, and that fear is going to go away because you ain't got nothing to be fearful. You don't have anything to be fearful of.
Yeah, I love that. As you were speaking, I was just thinking about like my precious grandson with our children. And probably some of that, and I don't know, Queen Dr. Leslie, maybe you can help me with this. I would think that some of that fear might be the way that our parents react to our illnesses when we're younger. Like, did they get really hysterical? Did they give you some education? Well, let's look at it. Is it really broken, or do you really just need a Band-Aid? So I would think that kind of plays into that.
It may play into it, Leah, but here again goes that blame game, right? And we can blame it on what our parents did when we were growing up. We can blame it on that if we want to. I mean, we have every right to blame it on it. But blaming is not going to solve your issue.
No.
Blaming is not going to solve your issue. So we, at some point in time, as adults, right? And if we have children, we're considered to be an adult. As adults, we got to say what it is that we want for us, what we want for our family, and we got to act accordingly. We can't keep drudging up something that happened 30, 40, 50 years ago and saying, well, my parents raised me like this, well, that's why I am like I am now. At what point in time do you, as an individual responsible for your own life, at what point in time do you take it and say, I can't keep blaming them, I got to change this? We can play blame game all we want to, but in reality, we've got to stop that. It doesn't help.
I put it another way. Suck it up, Buttercup.
Right.
Right? Things have happened. Listen, I was raised on food stamps, welfare, in poverty, surrounded by gangs and drugs. Just so you know, my parents, both of them, God rest their souls, they both were drug dealers. That's how I was raised.
Right.
And I didn't want that for my life. I knew as a little girl, I was like 5 or 6 years old, and I would be lecturing my mother, like, what are you doing? We need a better house. I kid you not. And my sisters kind of went a different way. So we're both raised in the same environment, and I took a different road, right? We all have our own path, and that's a whole nother conversation. I love this comment. Seek expert advice on this. Everybody has opinions. That's right.
Exactly. And that's exactly. And I myself want to thank Leslie Flowers for actually putting that comment out there, because that's exactly what it is that I've said from the beginning, the disclaimer I gave from the beginning. I am not a clinician. I'm not a nurse or a doctor, which is why I encourage you, everyone that's listening to this video, to use your voice. And then when you have issues or you have problems that occur in your life, you need to get those things checked by an expert. Use your voice. You use it for everything else. Why are you quiet when it comes to your health? Right? Why are you quiet? And you shouldn't be. So, Leslie Flowers, thank you so much for putting that out there, because I agree with you. You should seek expert advice from an expert, not, once again, Dr. Google or Mr. Firefox. You got to stay away from them if you don't know what you're doing.
Definitely. Well, we're kind of winding down here. You dropped so much gold, so many gold bars, so much wisdom. Definitely appreciate you, and I appreciate our connection. So you've done so much, you've accomplished so much, you've impacted so many people, Miss Sandra. What is on the horizon for you in the next 6, 12, 18 months? Share with us, Sandra Washington, and where she's going.
I am going to continue to use my voice to actually advocate for patients that need help. I want to say, whoever you are, wherever you are, if you find yourself at a crossroad and you're really not sure like where you can go, or how you can figure this out, I'm the person that you can come to and talk to if I don't have the answer, because I'll be the first one to tell you, I don't know everything. I really don't know. I don't know anybody on here on earth that knows everything. And I don't know everything. So for that stuff that I don't know, I have connections that I can turn to and say, hey, what is your thought on this? And what is your thought on that? So I continue to do exactly what I'm doing now, which is advocating, which is being that community support worker for those who, need the support. If the community needs the help, that's what I'm here for. Most importantly, I intend on continue to be Sandra L. Continue to make sure that all patients are educated, empowered, and engaged in their own health care. Because without us taking our individual responsibilities and making them do what it needs to do for you, it's not going to work. I tell people this all the time when they hear me speak and they're like, oh, Sandra, they'll clap and they'll say, oh, girl, how'd you do this? How'd you do that? And I tell them my health story. I also tell them, I don't want you clapping for me. I'm not telling you what I'm telling you for me. I'm telling you what I'm telling you so that you could stop and say, well, she did that. Maybe I could do it. Or let me see, how about me doing it? Don't clap for my story. Clap for your own story. And if you don't have one that looks good, then what I would suggest you do is start now and building that looks good for you when it comes down to your healthcare.
I love that. That's so great. I could just talk to you all day. I know you've made a lot of new friends here and a lot of old friends also, but if people are watching this team replay or they would like to connect with you, what's the best way for people to reach out to you? What's the best way for people to connect?
You can reach out to me on LinkedIn. I am on LinkedIn. You can reach out to me on LinkedIn. I'm also on Facebook. My email for you to reach me is Sandra@Chalms, and Chalms is CHLMS Foundation.com. Once again, Sandra@ChalmsFoundation.com. We have a professional we have a professional YouTube channel which is Medi, MEDI-HELPZ. If you go there, you're going to be blown away by all the information that's sitting there, video after video after video of information. You cannot go wrong. And I'm actually also, I think that's it. Facebook, LinkedIn, my email, my YouTube channel. And if I missed anything, just send me an email or contact Leah and say, you know what, I want to get Sandra, how do I do this? And she'll make sure that she sends me a message and tells me, hey, Sandra, can you reach out to this person? They really want to talk to you. And by all means, I'll get back to you.
Yeah, absolutely. We've done a lot of that. We need to do more of that, Miss Sandra. We have a lot of people, I think, that we could definitely open up opportunities for both of us. So I have a real quick video, and then I'm going to come back for my final thoughts. Don't go away. I want to share some final golden nuggets with you.
Hey there, I'm Leah Garcia. Have you ever wanted a career where you truly make a difference in people's lives? I'm building a team of driven financial and insurance professionals, people who want to help families and businesses protect, distribute, and transfer their wealth with confidence. If you're passionate about guiding others to achieve financial security, then you're exactly who I'm looking for. Join my supportive, growth-oriented environment and unlock your full potential. Ready to take the next step? Visit LiaGarcia.io and let's start building your future together.
Absolutely. I'm excited to build my team and excited to find some more champions who really could get behind this crusade and really want to be an advocate for people. And you shared this in our off-camera conversation, is that a lot of people who are in the financial space, including a lot of my colleagues, do not even talk about health insurance. And I think that is a huge mistake. I truly do. And by the way, a lot of financial professionals, financial strategists, wealth management, financial advisors won't touch it. They don't touch it because they're not licensed. And also it's not a very lucrative endeavor. Okay. It takes a lot of time to help somebody with their health insurance. It's a learning curve. We don't get paid a lot of money for it, but in my humble opinion, it's really the core foundation. In my wall of wealth, that's the first pillar I talk about is their health insurance, life insurance, and the disability. So you've shared so many great nuggets, so many golden nuggets. A few things that stood out to me is everything impacts our healthcare. We're all patients. We're a proactive patient, an active patient, or a retroactive patient. I never thought about it that way. We're either coming over an illness, going into an illness, or we're recovering from an illness, right? So that was gold. And also, when you talked about just really stop going to Dr. Google and Mr. Firefox, what was it? Dr. Google.
Dr. Google and Mr. Firefox.
And Mr. Firefox, because they're not your friends. Listen, it is our responsibility to understand what is going on with our body. We can't expect somebody else to understand all the nuances. We got to study ourselves. And remember, the information, the wrong information, the misinformation, the untruths that we are experiencing could be costing you your life. There's nothing more important than taking care of our good health. We want to be in the best good health for our future, for our family, and be able to have the experiences that we want to have. And I love this one last comment here. So many great nuggets. Sandra is an expert. She absolutely is. And we appreciate you. Well, thank you everybody for joining us. Shout yourself out, network with each other, get to know each other. My intention really here is for this to be a networking event. Most of the people I'm connected with are entrepreneurs, business owners, solopreneurs, and we have to take opportunities to get to know other people like us. Somebody is looking for you and what you do. Share your ebook, share your podcast, share your link so that people can see you now, and they can also, when they go back on Team Replay, they can see this. They can see who you are.
Leah, I'm sorry. I don't want to cut you off, but I do need to say this. I don't think I gave my website. And so our website is www.medihelps, and Medihelps is MEDIHELPZ.com.
Awesome. Please also share it in the comments, Miss Sandra. And you do podcasts also, don't you?
I do podcasts. We just started our podcast last week, and our podcast is called Patient Experience.
Awesome. Patient experience. I love that. Oh my goodness, Meryl, you're so adorable. I just think I'm in love with Meryl. Just really always pouring wonderful things into us. Yes, I do take notes. I am a chronic note taker. I don't just take notes, but I always have my pen and my highlighter. I take notes with highlighting, just so you know. This was a great time. Thank you so much, Miss Sandra. I appreciate you. I appreciate your connection. I love your advocacy. I love that you are truly out there making a difference. And it is truly a crusade, one patient at a time. I know that you treat every single patient, every single person that comes to you with those kid gloves, and you really take the time to find out what they need and who you can connect them with. And that is so rare these days. I honor you for that. I love that. Thank you, Miss Queen Doctor. So it is 6 fears. We have 6 human fears. If you could put that in the comments also, I would love that. So thank you so much, everybody. This is going to do it for this Wealthy Wednesday. I'd love to just keep going because we got a lot more to share, but be on the lookout because we've already decided we're going to start doing more masterminds together. So have a great rest of your Wealthy Wednesday. And remember, share this with somebody else who needs to hear this. Thank you, everybody.